Okay, in this video, I'm going to show you how to inject testosterone. When you get your testosterone, you're going to get 4 or 5 ml of testosterone. You're going to get alcohol pads, the 100 unit syringe, and you're going to get 2 separate needles, an 18 gauge pink needle, which is what you withdraw, and a 25 gauge blue needle, which is what you use to inject. And so when you do this, you're going to take your 100 unit, which is 1 ml syringe. You're going to just screw on the pink 18 gauge needle. When you take the cap off, what I want you to do is alcohol off the top of the testosterone bottle. Then what helps you withdraw is if you pressurize the bottle a little bit. So I'm just going to put 1 ml of air into the testosterone bottle. Inject that air so that when I turn it around, it's easier to pull out. Now, a couple things. You want to make sure the needle tip is actually in the testosterone fluid, because as the bottle gets smaller and smaller, the needle tip can actually withdraw air, and I've had some patients withdraw some air. So just make sure that the needle tip is in the testosterone fluid, and then slowly you're just going to pull back. Most patients are going to be injecting 40 units twice a week. Now, in order to do that, sometimes you'll have to pull back to the 60 line in order to get some of the air, but because I pressurize it, there's no air. And then what you'll do is you'll push down to the 30 line. Now, why am I telling you to push down to the 30 line? If you're going to inject 40 units, when you pull this out, typically there's 10 units still left in the needle tip. Because you're going to not use this needle tip, you would waste. So you're going to just pull out the extra testosterone that's in the needle tip. Now you have 40 units. Now you're going to recap the pink needle. You're going to screw on your blue 18 gauge needle. And now you're ready to inject. Where I personally inject testosterone is to the mid-thigh, specifically in the vastus lateralis muscle. So you take the medius part of your thigh, not the center of your thigh, not the outside of your thigh, but the thickest part of your thigh, which is about 1/3 of the way down from the hip, about 2/3 of the way up from the knee. You're going to alcohol off that area. You're going to take your testosterone syringe with your 25 gauge 1-inch needle, and you're just going to go straight in. Sometimes you'll get a little twitch like that, and you're going to push your testosterone, withdraw the needle, recap it, and you are done. You can also inject into the glute if the mid-thigh is a problem area for you, but most of the time the mid-thigh works perfectly well.
For more details and information, please contact us at 877-721-0047 or visit the FAQ section of our website at www.breencenter.com.